So the most common question which I get to hear in my OPD from my pregnant patients is, ma'am, will I have a normal delivery or will I have a cesarean section? What is better, normal delivery or a cesarean section? Will I be able to handle the labor pains? How long my labor would be? So hello everyone, I am Dr. Anjali Kumar. I'm a gynecologist and obstetrician, and I bring greetings to you from Maitri. Maitri is a space where we talk anything and everything about women's health. So what is a normal delivery? Normal delivery is a process by which the baby is delivered through the normal vaginal opening. Caesarean section is a process by which the baby is delivered after giving an incision on the abdomen and then onto the uterus. So now let's understand, why is caesarean section required? There are basically two types of caesarean section. Number one is elective, second is emergency. So elective means that the caesarean section is planned well before the woman goes into labor. Now the reasons for the elective caesarean section could be, number one, that the baby is very big in size or the maternal pelvis is small. Now medically we call this as cephalopelvic disproportion, which means that there is disproportion between the baby's size and the maternal pelvis. Second reason for an elective caesarean section could be a low-lying placenta. Now, placenta is an organ which connects the baby to the mother. Placenta is a very vascular organ because obviously this has to supply blood to the baby. Normally, placenta is located onto the top of the uterus. But in case it is there in the lower part of the uterus, during the dilatation of the cervix, the placenta could actually detach and can cause heavy bleeding. So low-lying placenta is usually delivered by a planned caesarean section. Other reasons could be that the baby is in a breech position or a transverse position or maybe some other positions. Normally, the baby is in a head-down position. But in case the baby is in a head-up position, which means the head of the baby is towards the mother's chest. Now, this patient also might require a caesarean section. In case the baby is in a transverse position, normally the baby is in a vertical position. But in case the baby is in a transverse position inside the mother's womb, obviously this is very difficult to deliver. Sometimes the baby is head down, but the baby could be in a brow position, which means the eyebrows of the baby are coming first. In case a woman has undergone 2 or more previous caesarean section, now that lady also might be safely delivered by a planned caesarean section. In case the mother is suffering from some serious infections like herpes, then also we would like to do a planned caesarean section because otherwise the baby is likely to contract that infection during the vaginal delivery. Somebody who's undergone some previous uterine surgeries, maybe somebody has undergone a fibroid removal in the past. This is called as myomectomy. This patient also would require a caesarean section delivery. Then let's talk about what are the emergency indications of a caesarean section, which means the doctor has actually planned for a vaginal delivery, but something happened during the delivery which required the doctor to take a decision for an emergency caesarean section. So number one could be fetal distress, which means that the baby's heartbeat suddenly starts dropping or starts showing certain changes which are indicative of some distress to the baby. Sometimes the baby poops inside. Now medically we call it as meconium staining liquor. Now this is also a very frequent reason for the emergency caesarean section. Sometimes, despite good labor pains and despite long hours of labor, the baby refuses to come down or the delivery fails to happen. This is known as non-progress of labor or non-descent of fetal head. Sometimes during labor, the mother starts bleeding unexpectedly. and there also we have to go for an emergency cesarean section. Sometimes the patients come to us with a very high blood pressure. Sometimes they could be even throwing some fits. Now medically this condition is known as eclampsia, which actually requires a baby to be delivered fast. So what is better, normal delivery or a cesarean section? So I would put it like this: anything which is normal is better than anything which is not so normal. I would not say cesarean section is abnormal. In case the cesarean section is done for a valid medical indication, it is better to have a cesarean section than having a compromised mother or a baby. Obviously, the normal delivery has its own advantages, which means that there is lesser blood loss, there is lesser pain, there is better recovery, faster recovery, lesser anesthesia complications, lesser infections. Normal delivery also offers a lot of advantages to the baby also. So during normal delivery, the baby is squeezed through the tight vaginal canal. Now this process actually squeezes the fluid outside the baby's lungs, and it helps the baby to breathe easier when it is born through a normal delivery. Babies who are born through a cesarean section may actually have a breathing difficulty, which is known as TTN, transient tachypnea of newborn. This happens because of that fluid which is accumulated in the baby's lungs. Also, when the baby is born through the vaginal route, the baby acquires good bacteria during this passage, which actually helps to improve the baby's gut immunity. So, what is the answer then? So, the answer is normal delivery is obviously better unless and until we have a valid medical indication to go for a cesarean section. So, what can I do to have a normal delivery? Number one, have a good antenatal care. Meet a doctor right from the beginning of your pregnancy. Make sure that you are eating correct. You are not consuming too many calories. Remember, when you are pregnant, you are supposed to eat for 2, but you are not supposed to eat double. Make sure that if you have diabetes or high blood pressure, that's controlled. Start by exercising at least 15 minutes daily and increase this time to almost 30 minutes daily. Make sure that you're walking and you are physically active in your day-to-day life. Prepare yourself well. Enroll yourself for an antenatal class or a birth craft class. Now we have prenatal yoga classes also. Do not worry too much about the pain. Now we have a lot of pain management options. We have a lot of drugs available. We have Entonox, we have epidural analgesia, we have water birthing. So make sure that you talk to your doctor, understand all these pain management options. You can actually make a birth plan for yourself. So birth plan is like a wish document wherein you can actually write as to what kind of a birthing experience you want for yourself. Learn some breathing exercises, learn the Lamaze breathing exercises. Make sure that you have a birthing partner. Now it could be your husband, it could be your mother, mother-in-law, sister, sister-in-law. Don't underestimate their importance in labor. They could help you with the breathing techniques, exercises, massages, and giving you that special emotional support which you require at that point of time very much. And most importantly, trust your body. Your body knows how to deliver. Your body knows its job. And once again, trust your doctor. That's most important. So next 2 weeks, we will be coming up with 2 special videos on exercises in pregnancy, the general exercises and the exercises which can help you in normal delivery. So today, as usual, if you like this information, please do not forget to like, share and subscribe to Maitri, and we will see you soon.